Hello, everyone. My name is Maxime Ronot.
Hi, I'm Riccardo Sartoris.
We are both radiologists working in Clichy, France, and we are very happy to welcome you today to this short video where we will be presenting a piece of research that we've done dealing with the quantification of the lobularity of the pancreas. And the exact title of our research is Quantification of Pancreas Surface Lobularity on CT, a feasibility study in the normal pancreas that we just published in the Korean Journal of Radiology. The study starts from a very different organ, which is the liver, and the quantification of the surface nodularity of the liver using a dedicated software has been shown to be very powerful for the detection of chronic liver disease and for the prediction of portal hypertension. And the software is actually quite easy to use. You draw a line on the surface of the liver, and it will automatically detect the margin of the liver and quantify the nodularity of the organ, comparing it to a theoretical, very smooth liver. And now a lot of publications have been issued over the past few years dealing with chronic liver disease and dealing with portal hypertension. And we thought that it might be interesting to extrapolate this technology to another organ that might be irregular, namely the pancreas, and to see whether or not this kind of quantification could be performed in the pancreas. So the objective of our study was just to assess the feasibility and the reproducibility of a pancreatic surface lobularity quantification on abdominal CT images. And we wanted to do that in a population of adult patients that were free from any pancreatic disease in order to provide possible normal references for future clinical studies. So we included patients that were referred to our center from a trauma, a non-severe trauma, and we made sure that these patients had no abdominal injury and no severe trauma. So the abdominal CT was unremarkable. We excluded all patients with possible pancreatic disease or lesions or calcification. We made sure that to exclude patients with an history of diabetes, because we don't know how much diabetes can influence on the lobularity of the pancreas. And we ended up with 265 patients that were eligible to PSL measurement. We could not perform the measurement in 15 patients because there was an absence of interface between the pancreas and the fat. So the final study population included 250 patients. So we performed the measurement on 3 different areas of the pancreas, 8 isthmus with 5 different measurements. So it means 5 different slices to perform the measurement. The body with 3 measurements and the tail 3 measurements. So the goal was to obtain 11 measurements per patient. And you can see here that this is pretty much the same kind of image that I showed you with the liver. This is the surface of the pancreas that is painted with the green line that will automatically detect the lobularity of the pancreas. So 15 out of the initial cohort of patients could not be analyzed because the software did not detect the pancreatic fat interface, as I told you. So the overall technical success rate was 94%. It means that we had at least one measurement in 94% of the patients. You see that a lot of individual measurements were performed, and overall 81% of these individual measurements were considered to be successful, which means that the software provided with a value. And you see that the successful measurements were quite evenly distributed among the different segments of the pancreas, but the tail was slightly more easy in terms of success. So at least 3 successful measurements were obtained in 98% of the patients, and overall 43% of the patients had all 11 individual measurements that were successful. One first interesting result was that the PSL was moderately but still significantly correlated with both age and gender. You see that this is the for the overall population, the moving average of over 10 years for the PSL, and you see that there is a slight increase with age, and you see on the right-hand side the difference between male and female patients, and the correlation was slightly stronger in male patients, and the PSL was also significantly higher in male patient compared to female patient, and it was true for all age categories. When we stratified patients according to age categories, so you see 18 to 30, 30 to 50, 50 to 70, and more than 70 years old, we observed a progressive increase of the average pancreas surface lobularity, and it was consistently true for all the pancreatic segment, possibly except the tail of the pancreas, but the very few numbers here are not quite significant. So let's summarize by saying that the PSL progressively increase with age. We also observed a moderately but significant correlation between PSL and the body mass index of the patient, the BMI. It was more pronounced for male patients compared to female patients. And you can see on the right-hand side of the slide the breaking into BMI categories. And here again, we had a progressive and significant increase of the PSL with BMI categories, and it was true for the head body, but not for the tail of the pancreas. When we combine all of that, this is a way of, let's say, summarizing the results. Since BMI was weakly but significantly correlated with age, it appeared that PSL was co-associated with both age and BMI. And you see that here when we perform the heat map representation. You have the BMI categories here, and you have the age here. And you see that overall, we have a smooth transition from the green value of the PSL towards the more reddish and orange value of the PSL with older patients and more obese patients. The measurement of the two readers that performed the measurement independently were very strongly correlated, and the overall inter-reader agreement was excellent. The intra-class correlation coefficient was 0.82, and you can see here the Blunt-Allman plot that showed a very small systematic bias. It was consistently true, whatever the segment of the pancreas that we chose. This is one example here. You see a figure extracted from the publication in KJR. This is a 41-year-old patient, and you see that we could obtain individual measurement from the head, from the body, and from the tail, and the overall PSL was 6.11 in this patient. So we can, let's say, summarize and conclude by saying that the CT-based PSL quantification was shown to be feasible with a very high success rate and a very good inter-reader agreement in patients free from any pancreatic disease. We found that PSL was higher in male patients and gradually increased with both age and BMI. We also realized that it was probably easier to perform measurement in the head and in the tail, but the body was less interesting, likely, probably because it was pressed against the stomach, so the quantification was less accurate. The study provides, in our opinion, reference for any further investigation assessing the possible diagnostic and prognostic value of PSL in a variety of clinical contexts, such as diabetes or pancreatitis, or initial work of patients undergoing pancreatic resection, and so on. With that, I would like to thank you very much for your attention. This is my email address. Feel free to send any comment or question, and I will be happy to answer you. Have a good day.